Welcome to Therapy with Josh D. I'm Josh Davis, a licensed mental health counselor in the South Florida area, and today on the podcast, we are talking to Leslee Gillette. Leslee is a dear friend and colleague of mine, and I think this is a really cool conversation. We get into talking about motherhood, postpartum depression, all the kind of nuances and changes that come with that. She shares her birth story. I think this is a great conversation for all of us to know and hear, because there's a lot of stigma around motherhood. There's a lot of cultural pressures. We get into kind of gender roles and how that kind of plays into complexity of things. I hope you guys learn as much as I did in this podcast. Let's dive into it because this is a really cool conversation. Hello.
Hi.
It's so nice to see you.
So nice to see you too.
You look great.
Thank you. I'm like looking at all your little things behind you. I love your backdrop there.
Oh, thanks. I
Yeah.
appreciate it. How are you feeling about doing this, first of all?
I'm excited. I'm excited. I think it's an important topic, so I'm looking forward to talking about it.
Just get started?
Sure.
All right, let's do
What?
it. First of all, how are the kiddos?
Thinking because it's been a rough couple weeks. Everyone's healthy. They're good. Everyone's
Oh,
healthy, so that means everything's good.
yeah. So I know I've known you for like years,
Ever.
but
Yeah,
for like other
yours.
people that don't know who you are, like,
Yes.
what do you do? Tell me about your family. Like,
Okay.
give me a little spiel about who Leslee is.
Okay. It's so funny. I was reading through some of the questions and I saw that you put on there, like, who are you?
Mm-hmm.
And I was like, at first I was like, that's a simple question. And then like I
Such a
sat
hard
down to do
question.
it and I was like, oh my God, why is this such a hard question to answer?
It's such a hard question.
So, okay, so I'm a mom, I'm a wife, I have two little kids that are 6.5 and 3.
Mm-hmm.
Um, I am a therapist. I'm a advocate for mom and dad's mental health post baby. Um, and yeah, I'm a licensed mental health counselor in a group private practice.
So, how long have you guys been together?
Uh-oh. 7 years. Like so hard to think
Okay.
about it. We always joke, we're like, it's been 84 years. I'm like,
Probably a long time.
yeah.
7 years married or
7 years
7 years
married.
married? Okay, great, good.
Prior to that, we dated. We were pretty quick. We dated for like a year and a half, and I moved in after like 4 months, and we've been married for I think 7 years now. I'm like second guessing, but yeah, it's 7.
That's awesome. Can
Yeah,
I ask you more questions about your guys'
yeah,
relationship?
go
Just
for it.
I'm fascinated with relationships. So I'm curious, like,
Yeah.
how did you guys meet? Like, was it like a meet cute? Like,
Oh my
what?
God, this is a very funny story, actually.
Okay.
Okay, so my husband's a firefighter,
Mm-hmm.
and my cousin is also a firefighter. And so I guess like 8 or 9 years ago, I was single. And we were at, I think it was Thanksgiving or Christmas, like the family was all together. And my cousin was telling the story about my husband. I didn't know him, at all. And he's telling the story about him. And I just made like a passing comment. I was like, oh my God, he sounds so funny. It was just like a funny story about him.
Hmm.
And my cousin was like, I actually think you guys might jive. And I was like, okay, so do something about it. So he gave my husband my phone number and he reached out to me and we went on a blind date. We talked maybe, I only think we talked for a couple days and then we met in Miami for dinner. And this sounds so cliche, but when I left, I remember calling my mom and being like, I'm going to marry him.
Like you knew instantly.
Yeah, like
Yeah.
it's hard to describe what it was. It was a feeling. It was just a
Hmm.
feeling. I felt like secure and
Hmm.
safe, and like also our personalities are similar and different, but there's like some
Hmm.
similarities there that the connection was like the
Makes sense.
banter was there. I'm like
Yeah.
really big on humor. He is too, so that like brought us close, and then not to again sound cliche, but that was it. We just started dating, and that was it.
Well, I think there is a part where like and you know until you don't know. I think,
Right.
right? Like when you
Right.
start a relationship with someone, like emotions are high, like we just get rushed with all these chemicals and we're like, oh my gosh, this person's great.
Yes.
And then we find out like maybe this person's not so great, or we keep finding out the more we learn about them, like, oh, this person is like legit. This is the person I
So
want,
true.
you know? So that's great. I didn't know what was like the first thing that like attracted you to him? Like when you sat down at that restaurant in Miami, like
Oh
what
God, that was so long ago and I was so nervous. I probably blacked out for a little bit from
probably
nerves
that's
and
typical.
anxiety.
That's typical.
Um, there was, let me think for a second. He was like very kind and like very interested in me.
Mm,
Like asked me a ton of questions about myself and like wanted to know so much about me and I like hadn't had that experience before. I feel like prior to that it was like flings and like my high school love, which like we
yeah,
all
yeah,
have
yeah. There's all
that.
that. Yeah.
So it was partly that there was a physical attraction too, like that definitely was there as well. But I think it was really like his interest in me and like how much he catered to like my needs and what I wanted. And that was, I had not experienced that
He
before.
tuned to you. Like he wanted
He
to
was
be like,
very attuned. Yeah.
yeah, cool.
We almost joke because it like teetered on the like, there was a period of time where I was like, I feel like you're interviewing me, but like that's not what it was. It was like he really wanted to know me and like asked me
Yeah.
real questions. He was also very serious about like building a family and like having a life. And I was at a point in my life where I wanted that. So I think our values at that time aligned.
Yeah, absolutely. Yeah.
Yeah.
Oh, I love that. When
Yeah.
did you guys how long were you married when you guys had kids?
Um, we were only married for a year. And then our
Okay.
first was born. So my daughter's she's not 6.5, she's 6. So and we've been married for 7 years. Yeah. So that first year we had her.
Okay. I'm curious to know like the transition between like being two, you know, married people and then
Right.
transitioning to having your first kid.
It
Like, what
was
was
so
that like? That
hard.
has to be a crazy experience because I'm thinking about like me and my husband. Like, all of our time is our time,
Yes.
and then you have this other little one that is like learning about the world and adjusting and changing and like
Yeah.
growing and like you're dealing with all your stuff and like
Yep.
you're trying to also like create a kind and loving environment for this new precious thing in the world.
Yes.
Yeah, like just talk to me about how that transition was for you guys and what do you think would be helpful for like other people to know as they transition into being a parent.
Oh gosh. I think you kind of hit the nail on the head. Like it goes from this lifestyle where it's just the two of you and you can leave freely and have date nights and connect and you know your ability to do that is it's easier and when you have a kid it makes it really challenging depending on your level of support. Like I don't think this is just like a one size fits all. I think it depends.
Hmm.
For me, I think for us, I mean after her I had a really hard time after her, just personally, which obviously impacted our dynamic.
Hmm.
I just struggled a lot emotionally. Her birth was like not what I expected.
Hmm.
It was kind of traumatic for me. Like we got separated. I had an emergency C-section. Like I really wanted to hold her after she was born, and I didn't get to do that. No.
Oh, I didn't know that.
Yeah.
Like they took her away.
Yeah, it was awful. Like,
My God, that does sound
yeah,
awful
it
for her
is.
and
And
for
I think
you.
that that's off. I have a couple clients, a couple mom clients that are kind of processing through that exact thing, that separation from baby at birth and how much that impacts a mom's connection and bond and mental health and emotional state. I mean, you imagine you create this life and you imagine giving birth and holding your baby and bonding with your baby, but it just you can't, it doesn't always go that way.
That's what we're
So,
sold. It's this like
huh?
ideal. That's what we're sold.
Right.
It's this, like ideal thing of like you get your pick. Like it's like the movie scene.
Uh huh.
Your baby comes out and it's clean and it smells great.
Yes,
Like
not like that.
like there's like skin to skin and there's this beautiful family moment and like I'm sure that's like a rarity
It is. I mean, I think it depends. Like I was determined with my second to like have a different experience as much as I could because there's so much out of your control, which,
Oh, I'm curious about that.
well, like with my daughter, I wanted to just let my body do what it wanted and kind of have her come when she was ready. And I ended up being induced, which I really didn't want, but at the time my doctor was like, "Oh, she's huge," which I learned later, like through mom groups and other physicians and other like midwives and doulas that like size of a baby doesn't really matter. But I was a first time mom. I was scared. I don't
Mm,
know, like you're telling me my baby's big, I need to be induced, I'm going to do it.
mm-hmm.
So I did it. And I was in labor for like 30 hours and nothing was happening. So I was exhausted.
Oh
They
my.
also don't let you eat, which is ridiculous, but they don't let you eat
What?
in the hospital. Yeah,
Like when you like for those 30 hours, you did not eat?
correct.
I didn't know that.
So I've heard
You're
people do
hangry. You're like,
hangry.
oh
I'm
no.
tired. I want to meet my baby. I'm also scared. I'm like, what's happening? Yeah,
Mhm.
there the no eating policy in the hospitals. Like, I mean, I guess in some ways it makes sense. It's like if we have to do surgery or like knock you out, like put you under anesthesia, you know how you can't eat before
That makes
like
sense.
a major surgery, which a C-section is, like a pretty major surgery.
Hmm.
So yeah, I ended up being sent for an emergency C-section kind of out of nowhere. I was literally, sorry, I'm like going into my whole birth story. Do you want me to keep
No,
going?
keep going. You share
Okay.
whatever you share. And I'm assuming this is like what got you into what you're passionate about now.
Oh yes,
Yeah.
a
Yeah.
1,000%.
Yeah.
This
Yeah.
is what sent me, and I can go into that too. What sent me right into like mom's mental health.
Mhm.
So yeah, so I got a call from my doctor. It was like 7 in the morning, and I was actually for the first time kind of relaxed. My husband was sleeping, and she called and she's like, "Hey, the baby's heart rate dropped a few times, so we're gonna do a C-section." And I was like, "What? Like, is she okay?" I'm telling you, it was the quickest thing. It happened like this. Before I knew it, the room was so many people were in the room. They were like doing all these things, putting all these things on me. My husband and I are like, "What is going on?" Like it's
Whirlwind.
scary, so scary. And then I'm being rushed down the hallway into an OR. And at that point, I was like, just get her out. Like, I just want her to be, I didn't even think about myself. Like, something
Hmm.
switched. I was like, I just want her to be safe.
Hmm.
So she was fine. They got her out, and I got to, like, I have one picture of her, like, kind of, like, there's like the curtain, and I'm like, got all these things plugged up, and she's like, kind of on my chest, which was like
Uh-huh.
very, very special. But then they took her to the nursery to just check her. And I was separated from her for probably, I don't even know, time went very slow and fast at the same time for a good chunk of time.
Uh-huh.
And that sucked. I mean, I really didn't want that. And in fact, when they asked, they were going to bring her in, and the anesthesia was making me feel a little weird. Like I was shaky and like kind of didn't feel super present and like myself. And I was like, I can't hold her. Like I feel like I
Just
almost didn't trust myself. I'm like, I don't feel right. Like I'm scared I'm going to drop her. I don't know. It's not ideal.
yeah.
So yeah, because of the way her birth was, it very drastically impacted my postpartum experience, which impacted my relationship with my husband, which is something I talk about constantly in my sessions with moms.
Yeah.
So I don't think people know that like birth and what happens in the birth is very much connected to the postpartum period. If you
Hmm.
have a birth where you're like, yes, I gave birth and I held my baby and nothing happened, and that does happen, it kind of reduces the anxiety and it doesn't like have that risk factor of developing postpartum depression and anxiety, which was my case. That was my case for sure.
Hmm. Yeah.
Yeah.
I'm just thinking about it in the context of like how everything is connected, right? And I think like in the in the medical world and like sometimes in therapy world, like we just like think about like this like here's depression, like here's
Right.
this one thing, and we don't think about how everything else is like influencing and impacting it.
Yes.
And like of course, like if you had an experience like that, it's going to impact the way that you are showing up in your relationship. Like
Yes.
I remember my sister having a C-section and seeing her afterwards, and I was like, "Oh, girl, you're rough." Like,
It's,
like,
it's rough.
and, like then you're expected to take care of this little baby, and like also like your husband like doesn't under like that's not his lived experience. So he's probably like, what the hell do I do? And just like all this other stuff. I just, it's
That's
nuts.
yeah, that's what I see. I mean, that was my experience. It's also, I think a lot of women's experience where dads feel, I don't see a lot of dads. I would like to, but dads, I
Mhm.
think, typically feel pretty helpless. And like, I think the running tape is like, I'm failing. I'm not doing good enough. I don't know what to do. How do I help?
Yeah.
Um,
Yeah.
the dynamic changes completely. I don't remember what your question was. I think you were asking me how like the transition was, I think was the initial question,
Yeah.
right?
Yeah. I do want to get into to that because you mentioned one time about how postpartum also influences dads, and I'm like very curious about that. This is
Oh
not
yeah.
so like if I'm
Yeah.
ignorant to something, like correct me, tell me
Yeah,
what
yeah, yeah, for sure.
I'm doing. But what you're sharing though made me think about this comedian. I can't remember who it was, but they're like talking about like how like when you come out like of the womb, like it is traumatic.
Of
Like
course it is. You're like
ripped
in
out
a
of this,
safe bubble.
yeah, you're in the safe bubble, this warm, toasty little like oven, and then like you're ripped and prodded, and like then like if you have a circumcision, you're circumcised, and like and like it's just
Mama.
like trauma. Like we're born in this world with trauma. I think like everyone has trauma in in this world,
Agreed.
and like with the training of like NARM that I do, neuroaffective relationship model, I'm thinking about that all the time of like
Mhm.
how our needs that haven't been met, not because like
Right.
parents are everyone's trying to do their best with what they have, right? And
Yes.
like parents, you're trying to do the best, and like you're just a human, but there's these like environmental failures that happen, not to blame the parent, but just because
Yeah.
like life is complicated, and you know being a parent's complicated, and
Yep.
everything is complicated, and we don't live in an ideal world, and that's where these
Yeah.
like environmental failures come into play, and
No.
just traumatic. So I feel like
Yeah. And I think like everything is unexpected. Like I know I think you wanted to maybe get into like what was the most unexpected thing, but like everything's unexpected. You're not really you don't really know what you're doing. So
Yeah, I wanted to
you
tie that
can
back because you were talking
yeah,
about control, and I didn't mean to cut you off, but
that's okay.
about the control, and it's very interesting because I have a lot of friends that have gave birth recently. Like, just had a friend that had a baby yesterday, and I was like,
Oh,
oh,
congrats. Congrats to
yeah,
her.
yeah. I was like, oh, I was so happy, and like friends that are planning to give birth like in this month. Everyone's just having babies, and it's so interesting to hear everyone like talk about the plan. And like this is what we're doing. This is how birth is. This is what like we're gonna have a natural birth. We're gonna and so like in my mind, because everyone's talking about this, I
Right.
imagine that you do have a lot of control. But it also, as I'm hearing your
Yeah.
kind of your story, like you don't really have that much because things don't go as planned.
Yeah. I mean, I think, listen, I've had a few moms that are pregnant and we have prepped, but part of my prep is also like knowing that your plan might not go as planned. And if that's the case, how are you going to cope with that? Right? Like
Mm,
there's certain things I think you can plan for. Like I think you can like more concrete things like we made sure we had like frozen meals in the freezer so that we didn't
that's
have to
smart.
worry about like I was like I know I'm not gonna want to like cook a meal and I'm sure you're not either because we're just like figuring out how to like keep a human alive, which is stressful.
Hmm.
So we did like frozen meals. I had like a lactation consultant just in case I had difficulty nursing. You can do things like hire a postpartum doula or a night nurse. So I think those things help, right? But then I
Hmm.
think things like a birth plan, like I always talk to my clients about you can have your birth plan, but you also have to know that the things out of your control are like the baby could be and then like a not so great ideal position for birth, and that could impact your birth plan.
Hmm.
Um, you never know what kind of nurses you're going to get. You never know if it's your doctor that's going to deliver. I mean, all those things can play a role in how your birth plan goes. I think having a provider that you feel is very in line with you is everything. I think that that really does change things. Like I wasn't super aligned with my first. I was like, oh, you're my OBGYN. I guess you're gonna deliver my baby. Like I didn't know. I didn't know.
Yeah.
And then after that, I was like, I'm finding another provider. And I did. And my
Mm.
second birth was the most healing experience because it went how I wanted, because I was listened to and they advocated for me. and I was like, I do not want to be induced. And they were like, okay. I'm like, how far will you let me go? They're like, we'll monitor you till 42 weeks, which a lot of doctors will not do. They'll say, oh, if you're not, delivered by 40 weeks, we're going to induce you. And there is a very high, not to be all medical, but there's like a very high correlation between induction and C-sections. So, certain things you can't control.
What's induction?
Oh, yes, of course. Why would you do that?
I don't know what that means.
Yeah. So being induced means they basically put you into labor. And they do that.
Oh,
Yeah. They do
got
that for like a variety of reasons. For me, it was like, oh, she's big, which big babies are, my son was 9.5 pounds. It's really not a factor, but some doctors like to say it is.
it. Okay.
There's varying opinions on that. But
Okay.
that's my opinion in my experience. So yeah, they do it for that. Like if the baby's not doing well, like in the womb, they'll induce you. They'll give you medicine or something in your IV to like
Hmm.
start labor.
Hmm. Okay. Yeah. It- I'm thinking about multiple different directions like
Yeah,
you can go. Because I do want to kind of hear how the shift happened, like what kind of shifted in your relationship. But I
yeah.
also want to ask you about like what did you wish you knew? Like now that you have had two experiences, um, like
Mm,
as a first time mom or
yeah.
parent, what would you wish you knew
I
that no one told you?
think, yeah, I think part of my problem the first time was that I was trying to achieve this like perfection, this like, I don't know, like do all the things and make sure you're soothed perfectly. And it was just, I was a little bit rigid and trying to follow like the sleep schedule. And I mean, there's a lot of opinions on infant sleep. And I was like trying to follow the schedule and it wasn't working. And then when it wasn't working, it was like, I'm a failure. I'm a bad mom. Like, and I see this so much with my clients too. Like, you have this plan that you try and make work and it's just like it's dependent on your baby, it's dependent on like your environment, it's dependent on so many things. And so with my second, I think part of why that was better was I was just like whatever is like I was just like much
Mm.
more accepting and I like relinquished control and
Yeah.
I didn't have that expectation for myself. And like if he cried for an hour, I was like, okay, let's go outside, we're gonna walk around, you're crying. Like with my first, I was like, oh my god, I don't know how to soothe you. And
Hmm.
I think I was not very patient or compassionate with myself. And I wish I would have
Hmm.
been more on top of that and more like prepped that like this is going to bring up some stuff and this is like, a good way to handle it. Just kind of being kinder and more patient. And you don't have to have it all figured out. I think moms often feel like they're not a good mom or they're a failure, they're doing all these things wrong when that's not true. It's just you're figuring each other out. Like this is a new human that you've never met. So you're trying to figure that out and it's tricky and hard. So I
Hmm.
think I would have known that like I wish I would have known that things don't always go as planned and that doesn't mean anything. It just is what it is. It
Yeah.
doesn't have to be perfect.
It's okay. I think that's like our American culture that
Isn't it though?
like let's package something, let's like, and I think that probably goes back to like there's probably pressure from the doctors that we have to like push out all these babies and make these things happen and
The
like
weight and the this and the that. Yeah.
yeah, because it is kind of unpredictable. And I think that like in the medical world and like even in the therapy world, like people try to push these things of like constraints and time periods, and that's not the way that life happens.
No.
And just being able to just let things be as they need to be is like so
And there
powerful.
isn't like one size fits all. Like
Heck no, not for
it's just
anything.
so different. Like, there's all these like mommy bloggers, some of them I follow and I love the ones that are like crying with no makeup on and like I'm having a shit day. I'm like, yes, I like you, you're real. But then there's these other social media representations of motherhood and it's so dangerous. It's so, they show the good and that's it. And so I'll
Mm,
have a lot of moms come in and they're like, well, how come I just had a session probably like a month ago where this mom was like, well, so and so, I don't remember who it was, not that it matters,
yeah.
looks like she has it all together and she's,
Mm,
you know, got all her kids in her car and her house is clean and her dishes are done. And I'm like, you're seeing 5 minutes of her life. That is not all of it.
what a great weapon to beat yourself up with, you know?
Oh
Like,
no.
and that
The
sucks. And that's
comparisons.
Yeah, but it's that this judgment, the perfectionism that creeps into our culture
Yep.
that is so destructive.
It's vile. It's like,
Even in
yeah.
relationships, right? Like there's this thing that's called, I don't know if you've heard this, but like the relationship escalator.
No, what is
And it's
that?
like, oh, okay, I'll talk about it. Um, but basically, it's like this, like this is what's sold to us. Like we
Okay.
go on, like we have a meet cute, and then we go on these dates, and then we get
Oh,
engaged, and
love.
then like we
Yeah,
move in together, and then we have this magical wedding, and then like it's these steps that we're sold to, but then we don't talk about what is after the wedding or like what sustains the relationship. But it's this
so
like
true.
this packaged, beautiful, perfect thing that we sold. And if I don't add up to this, then
Feeling.
I'm failing. The relationship's rad. Like then we push away. Then like oh, we're not right for each other. Where like shit happens. Like things are going to go
Yeah.
wrong, and it kind of sounds very similar to like kind of the birth experience.
Yeah, well, I was just going to connect it to even like the transition to being parents. Like
Yeah,
the conflict escalates. It does. I don't know many relationships personally because I obviously have a lot of like mom friends
yeah.
because my life. um, so personally and professionally, I don't know how you avoid that. I don't think it's avoidable because you're both sleep deprived, you're exhausted, you're burnt out, and you're not communicating effectively. And it's a recipe for conflict. And if you don't have those skills of how to manage that, it makes it
Mhm,
harder to manage.
mhm. Yeah, there's just all these stressors at play that are going to be making more susceptible to intense
Yes.
emotion and more
Yep.
sensitive. And I'm curious, like knowing what you know now, is there any way to like prep for that?
Um, I feel like prep for the things you can prep for, right? Like I think that'll help. It'll reduce vulnerability factors.
Hmm.
Go to therapy.
Yeah. Is there
Go to
anything like
therapy.
within the relationship that
Oh,
like
within the
you guys are
relationship.
prepping for? Yeah, in the relationship that you guys are like, okay, like we're gonna be stressed out, we're gonna be sleep
I
deprived,
think
we're gonna be like hungry, and like we're not gonna get our needs met. So like, how can we do this together? Like, what there any suggestions for that?
yes. I think again, I don't think this is like I think it's very common, but I don't want to speak for like everyone in the world, so I just have to make that disclaimer.
Heck yeah.
But there is still this imbalance that happens after you have a baby, an imbalance in the responsibilities and the day to days. And that imbalance looks like a lot falling on the mom. I feel like this is common in all my relationships personally and common in all my clients, where for one reason or another that I haven't yet seemed to figure out, I think there's probably multiple reasons. Um,
Sorry, can you hear that? That's my dog scratching or something.
what?
That's
Oh, I
literally
didn't hear
scratching
it.
herself. Oh, okay. Sorry.
No, it's okay. So yeah, I think that if couples can kind of sit down and really figure out the division of responsibility
Hmm.
beforehand, it could really reduce conflict and stress. We didn't do that. It's not like we sat down and had a conversation of like, okay, I'm going to be um, hoping to be nursing, which you don't know if you can nurse. Like that's what I would have liked to do, and it didn't work out for me. But I'm going to be nursing in the middle of the night, so can it would have been better if we sat down and said, okay, if I'm nursing, can you take the baby after I'm done nursing and change their diaper and put them to bed? We didn't do that. So here I am in the middle of the night doing everything, watching him snore next to me, and hello resentment, like hello
Oh, absolutely.
anger. Like I'm like, what the fuck?
Yeah.
I'm doing all this shit.
Uh,
And so I do think there are ways to communicate prior about the division of responsibility. There's a book, maybe it's a card game called Fair Play, and that's exactly what it's about. It's about moms having to pretty much carry the physical and more so the mental load.
the mental load. I was gonna bring that.
Mental load. I can talk about that all day.
Okay, talk about that because like I'm sure that because that was a new concept to me that you and someone else were talking about, and I was like, what mental load? And so tell me more like
Oh
what
boy.
mental load?
I'm laughing because shout out to my cheer moms if they listen to this, but we were talking yesterday about mental load and it's not funny. It's not funny, but I think we were just like giving examples that are almost like, is this really real? Like this is our life, like the mental load is basically the like invisible, not seen, not acknowledged
Mm,
load that a mom carries. It's like having a running list of things constantly. It's the,
mhm,
okay, you have this tomorrow. I have to pack your clothes. I have to pack your lunch. I have to take you to this appointment. It's just like a nonstop thought process that revolves around your children that I don't believe that dads have. In my experience, they don't.
mhm,
And maybe that's partly because moms are doing it, and it's just like, okay, well, you're going to do it anyway, so I'm not going to do it. Who knows? I think there could be
mhm,
many reasons, but the issue with that, and like relationally, is that it leads to so much resentment and so much conflict, and it's a big issue.
mhm,
And because it's invisible, it's happening internally and it's constant. It's like we're always thinking about like what the kid like anticipating the next need, which call it mother instinct. I don't know what it is. It just tends to kind of happen that way where it's constant and it's exhausting and no one acknowledges that. I think it kind of goes back into like, I don't remember what you said earlier about like you're expected to just move on with like you had a baby without now go live. I feel
yeah,
like that's
yeah,
part of it too, right? Like you create this human, you birth this human, and then there's this expectation of like, okay, now feed your baby and go on, move on with your life. And it's like, what? Like that's
mhm.
like there's no there's
Instructions.
very yeah there and there's very like little acknowledgement. I feel like in this country, acknowledgement and support for moms. Like there
Mm,
is this idea like, okay, go back to work, like you're done,
mhm.
and it's harmful. And relationally, I think that's there too. Like, oh, you had a baby, you're supposed to have a baby. Okay, you're fine. Moving on.
And thinking of like zooming out and thinking of like
Yeah.
really and like how the role of traditional womanhood has
Yes.
been of like you are supposed to be responsible and like you're supposed to take care of your husband and like make sure you're a good cook and like just think about it because like we go to Disney all the time and neither of us, me and my husband, like we're not parents, but we have
Right.
like a mom bag with all the needs and then it's like and it's
But it's
funny
called a
that
mom bag.
it's the mom bag, right? And it's just that's very interesting as you're talking
It
about it. It's
is.
like, oh, like it's just this like societally like pressured thing of like this is what moms are supposed to do. And now it's
Which,
like kind of shifted probably where like,
yes.
most are working moms and like there's this expectation now I'm like supposed to hold juggle like everyone's responsibilities and like being like the backbone of like the family system and where the dads traditionally are supposed to be like the financial backbone
Mhm.
and then now it's supposed to like also help financially like that has to be like just a clusterfuck of everything.
It is a clusterfuck. That's a great word to describe it, a clusterfuck. So
Yeah.
yeah, the mental load's an issue. I think that's something maybe couples can talk about and know about and learn about,
Hmm.
prior to, like I said, I think if there is a conversation about how to try preventatively to have more, I don't want to say equal, it's never going to be equal, but um, a better division of responsibility with little things. Like I gave the example of the nursing, or like, can you be in charge of diaper changes? Like, I know it sounds like minute, but if you don't have those conversations, it's very likely that either the mom's going to do it and she's going to be exhausted, or she's going to do it and not only be exhausted, but like resent her partner. And, there's going to be relational problems, which trickle out into everything else.
Absolutely. And I
Yeah.
do want to like acknowledge like not hating on like cis hetero dudes.
Yeah.
I do see that there's a culture that's shifting and changing of
Yeah.
fatherhood is changing and like fathers
Yes.
are taking on more responsibility and like
Yeah.
that's really cool to see from like even just like me growing up. And I think my dad was like really good at like helping my mom out when he could. But it's cool to see that like that is becoming more of the norm and like it's kind of like
Shifting.
celebrated. And I know that like a lot of times that men get celebrated for doing very like minor things and that shouldn't be like oh my god he like picked up the kid from school what a great husband that should be like an expect like that's something that it should be happening all the time but I see that
Yeah.
more and more which is
Yeah.
great so like good for you.
I literally had this conversation with my cheer moms this morning. I saw like a meme or a video of think it was Larry David, so of course it was funny, but it's like him going to get coffee for his wife, and he's like, "Give me the whatever shit that you do with the like not a clear order, just like very
Just make
like
coffee.
yeah, pretty much." And I sent that to them, and it was like, yeah, and then they get a big reward for going to get a coffee. And while it's nice that they're getting praise, there is this sort of underlying like, but like you also were part of this, so like we don't get rewarded. We don't get that's what I see a lot in terms of like inequality. It's like we're
Yeah.
expected to do these things
Hmm.
as moms, and
Hmm.
then there's like a lack of acknowledgement and validation. Whereas, oh, your husband's watching the baby, that's great. It's like, well, they're part of the picture. Like I don't get told that, like as a mom, I don't get told that. So it's like it's tricky. It's tricky.
Yeah.
I think there's a lot at play, and I do think there's some shifts. I am in the small group of dads that I've seen. I've seen a lot of dads really wanting to be proactive and involved and shift away from sometimes how their dads were. Oftentimes, I think it's a modeling. Like, back in the day, maybe dad worked all the time and mom did everything, and that's what they're used to, which is not their fault. But
Hmm.
I've had a lot of dads come in and say, like, I don't want to do that. I want to be involved. I want to be part of the family, and that's cool. It's very cool.
It's very cool.
Um, I also think it goes back to that idea of postpartum depression in men,
Yeah,
which
I'm so curious. Like, what is that? Because I thought that postpartum is like specifically just women.
I did too. I did not learn about this until I did my perinatal mood and anxiety disorder training, and they brought it up, and I was like, "What?" I did not know, and then I was like, "Oh my god!" Like I could see that. So basically, it shows up as a result of like relational changes, the life change, and it's similar. It's like low mood, it's irritability, it's anger, it's disconnect from family, substance use often. So that can be a factor in a presentation that seems like I think it gets misinterpreted in some cases of like, well, you just don't care, or like your judgments and misinterpretations. Where in reality, some dads might actually be struggling,
Mm,
and then add on top of that that there's I feel like there's still, I mean, you could speak to this too probably, there's still a stigma, I think, of men getting mental health support, which
absolutely.
prevents them from saying anything, and then they suffer in silence, and that's an issue too. That's a whole nother
Hmm.
issue.
Hmm. Yeah,
Yeah,
it's a whole nother
yeah,
topic and everything.
yeah.
But like the whole thing of like white middle-aged men suffering like quietly, like it's a
Horrible.
thing. Yeah. Um, but I'm also curious, I'm sure, and this may not be a thing, but as you're talking
Yeah.
about it, like everything is changing.
Uh-huh.
And of course that's going to impact the dad.
Yeah.
And like if the mom is like going through a challenging time, dad is also going through a challenging time.
Hmm.
Um, and I'm assuming too that like your sex life changes because
Oh, that was on my
you
list. Yeah.
change. And I wonder too, because this is not my realm. Like,
Yeah.
I'm not in a hetero relationship,
Hmm.
but I'm imagining that there may be even like some resentment towards the baby that the dad may have of like, what the hell?
Yes.
This is not the same
Yes.
things that I was working with before.
Yes. 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 I feel like physical intimacy changes. I think it's really common for it to be like gone for the first couple months. Sometimes, not all the time. I'm not saying that's like a blanket statement,
Hmm.
but yeah, I think you're right. I think there is this feeling of resentment towards the baby, and also just that's I think where their resentment comes from with their partner. It's like, what about me? Like I have needs too, which is valid. Like, it's valid.
Yeah.
Um, but again, it's tricky. It's like I know for me, after I gave birth, that was the last thing on my mind. I'm like, I don't have the energy. I'm being touched all the time. I'm nursing. Like,
Yeah.
no, thanks.
Yeah. Yeah.
So, but it's common. I think it's something, my moms bring up a lot that, oh, he's asking me to do this, but I don't want to, or I don't feel like it, or my needs aren't being met because I have this mental load and he's not acknowledging it. And then you can see how this kind of plays out into this really ineffective, conflictual dynamic.
Hmm.
I mean, it can be worked on, but I think I see that a lot. Well, he wants to have sex and I feel unsupported and alone, so no. And it's like, it's not helpful. I get it, but it's not helpful.
Mm-hmm. Yeah.
Yeah.
Yeah. And I just kind of want to go back because
Yeah.
well, how would you define postpartum? Because I always thought postpartum basically was postpartum depression. And now I think there's like a lot of more things that are coming from it. And you
Yes.
mentioned like postpartum anxiety and like, so
Yep.
how would you define like what postpartum is?
So, first, I want to say that I think people oftentimes confuse what we call the baby blues with a more serious thing like like postpartum depression or a perinatal mood and anxiety disorder.
Okay. What is
Baby
baby blues?
blues. So
Okay.
baby blues are the hormonal shift that happens the first couple days, I think to a week maybe after you give birth. Your
Mhm.
hormones are trying to regulate. They're
Mhm.
kind of just like off kilter, off balance, if you will. And that happens for a shorter period of time than a perinatal mood and anxiety disorder would. And it looks like tearfulness, withdrawn, crying easily, not wanting to eat sometimes. And it's all hormonal. And it
Okay.
typically levels out at some
Okay.
point, and then
So
that
that's
kind of
like
kicks
normal
in.
and typical.
Yes.
Okay.
So I also think like just connecting quickly, like for partners and family members and support systems to know that like that's normal. It's
Hmm.
gonna happen. You're gonna be more
Nothing's wrong with you.
emotional. Yeah,
Your body's just adjusting and
exactly. So the perinatal mood and anxiety disorder is kind of like an umbrella for all these other more specific mental health
okay.
disorders.
Sure.
So postpartum depression and anxiety. There's also postpartum psychosis, postpartum OCD, and postpartum bipolar disorder.
Interesting.
Yes.
So
So
interesting. Okay.
I don't really have too much experience with the postpartum psychosis or postpartum bipolar disorder. Um, I only know a bit from the training that I did. I mean, postpartum psychosis is very high risk of um, suicide and infant deaths. So it's
Like
serious. It's
like
very serious.
homicide?
Yeah.
Like kind of like what isn't that like Rosemary's Baby type thing or
I don't know what that
what's
is.
that story? What is it? Isn't there like a story about like a
There
mom
probably is.
like drowning her kids or something? I think that's like
Oh, yes, yes, yes.
I don't know what that is, but
Yes. Yeah. So postpartum psychosis, I mean, it's psychosis, right? Like you're having auditory hallucinations, visual
mhm.
hallucinations, intrusive thoughts about harming the baby, which is also a symptom of postpartum OCD. So they're serious. I mean, postpartum psychosis is considered like an emergency, like
Okay.
needing like hospitalization. Yeah.
Wait,
Yeah.
okay. So like Harmy's like, oh shit, okay, like this sounds helpful. And then you said hospitalization. I was like, oh damn. Because like me and
For
you know
stabilization.
is not
Yeah.
like so this is wouldn't be like in Florida we call it Baker acting or like going to like a like the psych ward for stabilization, or would
I
it be?
think it could. I mean, I think ideally you would want them to go voluntarily. It's just think about the mental state, right? It can be hard to have them go voluntarily. I
Mm-hmm.
haven't teetered in it at all. I just know from the training and then from some things that I've read, it's I know it's serious, and I know that if someone were to walk in my door, I would have to take it really seriously.
Yeah, absolutely.
Um, they did have it was interesting. They had in our training a mom come talk to us that had postpartum psychosis, and it was heart
Mm,
wrenching.
I'm
It was a
sure.
really heart wrenching story. So that can happen. I can't speak too much about it because I don't want to give misinformation.
Yeah, yeah, that's really good.
Um, but postpartum depression and anxiety, it's a mood disorder that happens that can last up to. So people think postpartum is like 6 months to a year, but the definition of postpartum is up to 2 years. So you
Oh,
can experience these, mental health struggles for a long time. And they do require intervention. That's the difference between like baby blues and an actual
okay.
perinatal mood and anxiety disorder. Medication sometimes, therapy, cognitive behavior therapy, and typically the development. It's a couple factors. If there's a pre-existing mood disorder or anxiety disorder, increases the likelihood.
Hmm.
But also things like the birth is a risk factor.
Mm,
Um, Nursing can sometimes complicate that
mm.
and lead to depression.
So
And
like family dynamics
I
too.
was just that's what I was saying. Lack of support, like, will kind of just lead you right into it.
Make a great chaos stew.
Yeah, it really will. And I think majority of the cases I've seen with our postpartum depression and anxiety, they feel unsupported and alone. And
Yeah.
their partner doesn't get it. And I think that that's why I try and pull the partner in as much as I can. Psychoeducation, psychoeducation, psychoeducation. Like,
Yeah.
here's
Yeah.
how to help. This is what you need to do. I mean, it's hard to understand because it's not their lived experience. They're not experiencing that.
Yeah. I,
So,
I'm thinking about kind of like what we talked about before about like kind of gender roles, like traditional
mhm.
gender roles, and you were talking about kind of all the hormone changes and like the resentment building up and the anger, and I'm sure when that spews out, because that's going to spew out because we're human, you're women are probably labeled
Crazy.
like crazy and like what the hell, and I'm sure like if someone is struggling, like the baby blues kind of last longer, or like they're starting to have some OCD
More
traits,
serious
more
symptoms.
serious symptoms, they don't want to tell people because they're going to be labeled as crazy or like
Yeah.
yeah. Uh,
That, yeah, go ahead.
I was just gonna ask, like, if someone is in that situation, what is helpful for them to know? Like, what would you want to say to them?
There is support available. You do not have to feel like this forever. There's treatment options. Postpartum Support International is like an amazing resource. They have virtual help. They have a hotline for emergencies that you can call anytime. Um, I think like more awareness is probably needed. That's partly why I want to like advocate more and educate more, because I still don't think, sadly, it's talked about enough, or even worse, sometimes I think it's normalized. Like, I've had a lot of clients come to me like, well, my friend said that this was normal. And I'm like,
Hmm.
it's not normal. Like,
Hmm.
that's depression. That's severe depression. You have low mood. You can't bond with your baby. Like, that can be treated and it's not normal. So, yeah.
Like, pull yourself up from your bootstraps. Like,
Yes,
you're
totally that.
fine. Just like
Well,
effort more, and it'll be fine.
that's what I hear. Yeah, that's what I hear with my moms from their partners and family members. It's like, well, aren't like shouldn't you be better by now? Or like, why do you still feel this way? Or
Mhm.
you're crazy. Postpartum rage is also something that like people, because I think of the stigma, people don't want to talk about it, but it's super
Mhm.
common, and it's exactly what it sounds like.
Well, at least for me, like the definition of rage that I tell my clients is like it is the pileup of suppressed anger. So you shove, 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 and it's anger that's been prolonged, and it's just
Mhm.
like this like fire kind of like spewing, like
Yeah.
just because there's not a met need, and that's really what anger is, right? Is like the
Mhm.
suppression of like a need not being
Right.
met, and just being this aliveness coming online to be like, hey, something's I
I
need
need
something,
something. Yeah.
right? And I think there's like a whole wrap of like anger and like, anger is this bad thing and like we need healthy aggression, you know, to like
It's
navigate through the
telling
world.
you something, right?
Yeah. Um, so that's fascinating.
Yeah. Yeah. I think the like not wanting to reach out, I think, has changed a lot. I think particularly with like on the more severe side, like postpartum OCD, postpartum psychosis, there's fear of stigma, but I think I know there's also fear of like the baby being taken away from you, which which causes people to not reach out for support,
Hmm.
which is a systemic issue that I won't get into, but
Yeah.
there's a huge fear if I go get help or if I admit that I'm having, like even part of postpartum depression and OCD, but one of the symptoms can be intrusive thoughts, which are unwanted thoughts
Hmm.
about harming the baby. And
Hmm.
there's a lot of understandable fear. If I tell someone that, is my baby going to get taken away from me?
Hmm.
So, big barrier to like access to treatment.
Yeah. It's like such a bind that we're in, like that moms are probably in of like, I need help, I want help, which is like this like
They're
probably like healthy, like, adult consciousness type thing. And then there's this like, don't tell anyone, shove it down, like the fear that takes place, and that like that bind has to be so painful to live
It
in.
is. It is. I think after my first, when I was in that place, it was like the darkest I've ever felt in my life. It was just like, I just remember laying on the floor and like crying. And that's probably when I realized, like, maybe I should do something. Like, I don't
This is
know if
not
this
normal.
is normal.
Yeah.
um, yeah. So
In
I
that
think,
darkest
yeah,
place of you
yeah,
like laying on the floor crying, we've all been there.
yes.
Um, what would you wish someone would have said, done, or what would you wish
Mm,
that you could have done in that moment? Or what did you do that was meaningful or helpful to you?
okay. What did I wish? I honestly wish I could have just, this is gonna sound childish, but I wish someone would have just like hugged me and told me like it's gonna be okay, things are gonna get better, and we're gonna figure this out.
I just want to be like, don't judge that. Because like,
I
of
know.
course you want to hug.
I
You're
know.
you're
I know.
human.
Thank
Like
you. Thank you.
we're always looking for attunement and love and connection,
Yes.
because that's what we're like created kind of to be. That's
I
where we
know.
thrive. Like otherwise we get picked off by evolution, the tigers and bears.
Right. It's true.
Yeah. So
Yeah,
of
I
course.
felt very alone and like misunderstood, and I was judging myself like I am crazy. So yeah, I wish that I had anyone, no one in particular, just anyone to be like,
Anyone.
you're gonna be okay. We're gonna figure this out.
Yeah. And so many
That.
of these like things, because a lot of what you've been like in regards to the relationship piece, I'm thinking
Yeah.
of me and my husband, and we lost family members very close to each other that in this short amount of time
Yeah.
of each other. That was very, very hard for us, and we had many vulnerability factors in play. um and I lost my thought actually.
What was I talking about? Being alone on the floor, wanting someone to
Oh,
hug
oh yeah,
me.
yeah, yeah. How in these really dark hours, in these dark times of our lives, there's nothing that someone can say. There's nothing really that people can do except to be like present and be like, "Hey, I'm here,"
Here.
and like just like be able to connect in a non-judgmental way. And as
Yes,
humans, I think
yes,
that's like
yes, yes.
the best thing we can do for each other.
I know the amount of times I'm like irreverent with some of my dads. I'm like, don't fix it. We don't need to fix it. I'm gonna help her. Just sit,
That's how
validate,
dads are taught.
hold.
Like,
And men like fixers, and there's a time and a place. I do think there's a time and a place, but
oh
I
yeah,
think when we're in that dark place, it's way more about like, I'm here. You're not alone.
yeah,
Period.
yeah.
So that's what I wish. That was what I needed. And then you said, what did I do? It's so crazy because I did have judgments about this. I'm like, how am I a licensed clinician and I didn't realize that this is what, like, I didn't realize that what I was experiencing was a perinatal mood and anxiety disorder. It
Mm,
took me, I think my daughter was like 6 months, and I had been struggling that whole time. So
mm.
that's a long time to struggle in that way. But
Oh yeah,
that moment, I'll never forget it. That was when I was like, okay, I need to do something. Like, this is not healthy for me. It's not healthy for my husband. It's not healthy for my daughter.
hmm,
And I went on Psychology Today and searched up like maternal mental health. And I found a therapist, and she was vital to me kind of crawling out of that hole.
yeah.
And honestly, it was the space. I don't think she told me anything like profound. It was
Uh,
holding space for me that pushed me into recovery, if you will, to a different place. It was just the
yeah,
holding space that was really needed, I think.
yeah, yeah. Of course.
Yeah.
So we're gonna need to wrap up because of time, but I am curious to know, is there anything that we have not touched on that you feel like is like really important that needs to be discussed? There's so many things that I could like talk to you about, like
Yeah.
complain about, and if you want to do this again, you're more than welcome to come
Yes,
back.
yes, yes, yes.
Like
I
we'll
will. I'm
talk. But
going to.
is there anything that like you're like, man, like we missed or anything, or are you ready to kind of land this plane?
Yeah, I mean, I think mental load was like a big thing I wanted to kind of describe, and then the difference between like baby blues and actual perinatal mood disorders, and knowing that like there is access to care.
Hmm.
Um, PSI is a great resource. I can't say that enough. I really want to like put that out there for anybody listening.
Can you send me all the resources? I
Yep.
just want to put them in wherever this
Sure.
is like
Yeah, let
posted.
me look at
Um,
those.
that'd be wonderful. I learned so much, like, because this is
Good.
the world that I am in, and because I work mostly with like queer,
Right.
relationships, and there that brings in a whole nother dynamic.
Yeah.
Um, but I'm so curious, like, and I work with a lot of like attachment wounding and trauma, so it's
I
interesting to hear
know.
the other side because I'm always thinking about like birth, like in the moment
Hmm.
of birth and like kind of developmental stuff,
Hmm.
rather, and then it's interesting to hear all these things about moms, and I think it gives me a lot of compassion for moms,
Yeah.
because like I feel like we're all trying to do our best, and
Yeah.
like life's hard. I mean, it just,
Life's hard.
yeah. So
Well,
if people want to like work with you, if people are
mhm.
curious to like know more about you, where can they find you? What can they do to like connect with you?
Go to our website, www.mimopsychotherapy.com. I'm hoping to start a social media, but that's not yet in the works.
Do
You
it. I'll
need
help you if
to
you
help
need
me with
help.
that.
I'll help you.
Yeah, help me with that. Oh, I run a DBT group for moms. Shameless plug. And all that information is on our website.
Cool. Great. Well, thank you so much for your time. I really appreciate
Thanks
it.
for having me and letting me talk about this. And this is so important. So thank you.
Yeah, of course. Thank you. I hope this conversation with Leslee was as helpful for you guys as it was for me. If it was, please let me know. Please give me a rating, a review, share with a friend. Any of that helps. If you're interested in working with either me or Leslee, you can find our contact information in the show notes or the description below. That's it for today. I hope you all are safe and I hope you are well. And until next time, this is Therapy with Josh G.
Do I hang up now?
No, we'll just end it. I'll just stop recording.